So when you come in on treatment day, you're going to come in through the revolving door, and this is where the greeter sits, and then you're going to come across the lobby to sign in. So I just want to show you there's a couple of places that you can sign in. If you're coming for lab work on a day that you're not getting treated, that means you're not getting an IV placed and you're not getting any other services from the treatment area, you would sign in at the laboratory services. Blood work only. If you're coming on treatment day for treatment, you're going to sign in at the treatment area. I'm going to show you where those spots are. If you want to follow me this way. You see here, this first cubicle says laboratory check-in. That's for laboratory check-in only. And if you're going to come for treatment, then we have treatment signs for treatment appointments. We sign in here. You're going to sign in at the clipboard and then have a seat. The ladies will check you in and then they're going to call you back up to verify your information. It's really important at that time if you've parked your car with the valet, that you get your ticket stamped. That way you don't forget on your way out, because you don't want to go over the whole way to the valet to retrieve your car and not have your ticket stamped. So I'm going to come this way into the treatment area. So this big door is where you enter the treatment area, and you will be called in by one of my staff at that point. One of my medical health techs is going to come over here and call your name, and then they're going to bring you into the treatment area. So this is the first stop for everything, regardless of what you're coming to the treatment area for. When you come in, the medical health tech is going to give you an ID van, which we've already talked about, which looks like this. We'll have your name and your birthday on here, and they're going to verify all that information before they put it on you. You're going to wear this the entire time you're in the treatment area, because this is what the nurses are going to be double checking as they administer all of your treatments. This first area is what we call level 1, and in this area, if you were coming on a day for just an injection, if you have a portacath in your chest that we were going to access for just lab work, or even when you're not getting treatment actively, it needs to be flushed every 6 to 8 weeks. So those kinds of things would happen in this area. This is where the unit clerk sits. It's a good place for information within the treatment area because it's almost always manned by at least one person. I'm going to show you a couple of things as we go through the treatment area. One of the very important things is where all the restrooms are, because once you start getting IV fluids, it's going to be one of your favorite spots to hit as you're going through. So this is where the first restroom is, and that's located right inside the door from the treatment area. Notice that we have hand sanitizer outside every restroom. There's also hand sanitizer outside every room, and this is important for you and my staff to be using. You don't know who goes in here and washes their hands appropriately and comes out touching the doorknob or not, so I would either use a paper towel to use the doorknob, or I would use hand sanitizer as you're coming out. So all of my staff should be using the hand sanitizer before they come to you and after they leave you, or washing their hands at the sink with soap and water. If you follow me this way, we're going to go into the treatment area. And this is the first of 3 nurses' stations. This first nurses' station is what we call Bay 1. All of the chairs are numbered, like in our video I showed you upstairs, the picture. Chairs are numbered 1 through 13 on this side at the top. And then every chair is separated by the curtain, so you have privacy. You can pull it around you, or you could leave it open, whatever your preference is. So there's a couple things in the treatment area that I want to point out. The first thing is the filtered water station that's over here on the countertop. It's the silver box with the green light. We don't do bottled water in the treatment area, but we have filtered water in both of the nurses' stations, so you can help yourself to that at any point. In addition to that, this is where the coffee is located typically. So you're going to pick up your pod here before you bring it into the pantry to make your coffee at the Keurig. So the nurses that are working in this nurses' station are treating these patients in this area. You're going to follow me. I'm going to show you where the pantry is at. It's right around the corner here, and it's a little bit of a tight squeeze. This is where the Keurig machine is located, where you can make your coffee. We also have the microwave and the refrigerator here. So as I had mentioned upstairs when we were talking, if you want to bring your lunch on treatment day, this is where you would keep it. You're going to make sure you label it with your name and the date before you put it in there. And then the microwave is, you can use to heat up lunch or heat up anything throughout. This is the lunch cart that we talked about, and this is the cart that comes around around lunchtime between 12:30 typically to all of the patients. When we're done passing lunch to all the patients, this is where it comes back to. So any of the fruit or snacks or things that are left over, this is where they're located. Anything that requires refrigeration then gets removed from the cart and is put into the refrigerator. So once it's here, it's free. You can help yourself to it. So we're gonna walk this way. This is restroom number 2. Again, hand sanitizer outside. This is the second nurse's station, and it's a little bit bigger because the bulk of the private rooms are over here. And as you can see, they're all kind of set up like regular hospital rooms if you've been hospitalized at any point. And like we talked about before upstairs, the private rooms we typically reserve for patients who are coming in for their first time for a couple of reasons. That way, if they're not feeling well during treatment, if they have any type of allergic reaction, we're able to manage it a little bit better. But really the biggest thing is so that you're very comfortable, and we try to reduce anxiety as much as we can. And we're able to close the door and close out the distractions because we're teaching you so many things on that first day. We want you to be able to focus on what we're talking about and hear what we're talking about. Sometimes it gets a little bit noisy in here with the phones and the IVs and the IV pump ringing and the nurses and all of the hubbub that happens in the treatment area. Sometimes it's a good distraction, but on that first day, it's really necessary to hear what we're talking about. So if you make a left here at this corner, this is where our third and last patient restroom is within the treatment area. Again, these are the 3 within the treatment area, but there are also restrooms in the lobby. If by chance you need to use a restroom very quickly and these are all occupied, you're always able to go out to the lobby to utilize those as well. If we walk this way, this is one of the vital signs stations where you might be stopping to get your vital signs. We talked about each time you come, we're going to measure your height and weight. Typically, we measure your height every 4 weeks or once a month. Your weight we get every single time because we talked about the importance of that. It's very important to dose your chemotherapy to the appropriate weight. And then this is where the triage nurses sit. So when you call in to talk to the nurse helpline, this is where my nurses work, and this is where they sit. So they're right within the treatment area. They have access to the treatment nurses. They're able to ask them any questions if necessary. They have access to the same computers, and then all of the treatment nurses rotate through this area and work on a regular basis. So they're very well aware of the kinds of issues that patients call in with, and then they are very well aware of the treatments that we're providing as well. And if you keep walking, we're going to end up the same place we started. So the treatment area is kind of a big square. If you keep walking in the same direction, you're going to end up back where we started. I'm just going to give you a quick peek into one of these rooms. This is one of the rooms where if you were coming for just blood work to be drawn by my staff, or if you were having your port accessed or an injection, this is the kind of area where that would happen. And then over here to the right is an area which we call short stay. You may end up in here at some point where we just give some shorter infusions. Again, it's kind of set up, there's a couple of chairs in here and there's one room. So these are all areas that you may end up receiving your treatment in as you're coming through the treatment area. My office is right here, and that's also a good spot to notice. If you have any questions or concerns throughout your treatment, if there are any issues as you're going through, don't hesitate to stop by and poke your head in. And then also the last important thing to know is the exit door. So this is the large door that we came in from the lobby, and that will put you right back into the lobby. So I hope you enjoyed your tour, and if you have any questions, please don't hesitate to stop and ask.